Welcome back to Fox 11. Every day there are so many new reports about the coronavirus, it can be hard to keep up. So this morning we're going to try to nail down a couple of new things that we know about variants and vaccines. What we know this morning and what you need to know. Dr. Ernst von Schwarz joining us once again. Thank you for being here, Dr. von Schwarz. All right, let's start with just how things have maybe changed over the last couple of weeks. You're in a hospital every day. Have things gotten better?
Absolutely, yeah. I mean, the 4 weeks from mid-December until mid-January was an absolute nightmare, as we discussed before. But within the last 10, 14 days, there's definitely less hospital admissions and less people die of COVID-19. People are still dying. There's more than 3,000 in the US per day. But the numbers are going slowly down, and we see that. We have a little more ICU capacity right now, so it goes in the right direction.
Good. So a good update there. We also heard yesterday from Governor Newsom that California is going to be pairing up with the federal government to open up these super sites, one in Oakland, the other in East LA. Could this be a game changer on getting more people vaccinated?
Well, we hope so. We need more vaccination sites. We need more personnel to help with that, of course, and we need more vaccines. So whatever the government can do to support this is welcome, because we need more people getting the vaccines in their arms.
And then the AstraZeneca vaccine, there's some new research out of the UK showing that it not only protects from getting COVID, but could also slow the spread as well. Could you kind of explain how that works?
Well, that's very controversial, by the way. So I'm not a believer in that because those data have not been peer-reviewed. That was an announcement from AstraZeneca that the transmissibility supposedly is reduced, but that's unproven. So what they did is basically they looked how many people tested negative after they got the vaccine, which means that they are not infected. But that was a relatively small number of people, number one. Number two, the data have not been published or peer-reviewed, not approved by other scientists. So there's a chance if we reduce, of course, disease, we know that the vaccines can do that. That's a good thing, but there's no proof now so far that the transmissibility can be reduced. The other companies have not made statements, the other vaccine producers have not made statements in this regard. So as of now, we still have to consider that even though we reduce disease, we might not reduce transmissibility of the disease. We still need to wear our masks. Very interesting. I know Dr. Fauci had mentioned that as well. He wanted to see it for himself, the evidence that that was actually the case. All right, then we have these variants that are popping up across the country. It seems like healthcare providers are getting a little more concerned about them just because we don't know what they could lead to. What can you give us an update on variants today? Well, the UK variant has been documented now over 540 times in the US. Recently, the what is called P1 variant from Brazil has been detected in one patient in the US, and the South African variant at least in 3 patients across 2 states in the US. So we are very concerned about the South African variant right now, even though Pfizer-BioNTech as well as Moderna stated that their vaccine might be helpful in reducing and fighting that mutant. It's not proven either. Interestingly, Johnson & Johnson just released their data, and they are, as you know, they are trying to get FDA approval for emergent use vaccination for their single-shot adenovirus vaccine. And they tested in South Africa, and in South Africa, 57% reduction of severe disease was documented, whereas in the US, 77%. So there's some efficacy, obviously, against that South African mutant, but it's not as strong as against the other common variants. Dr. Ernst von Schwarz, thank you so much. Trying to weave our way through these ever-changing days of the coronavirus pandemic. Thanks for joining us. Thank you.